Good afternoon, everyone. We'll just give folks a couple minutes to join and then we will get started. Thank you all for being here today. Okay, looks like people are trickling in. Thank you all for joining us. Just as a reminder, we will remove all AI note takers for policy. Okay. Okay, I see the numbers ticking up. So we will jump in because we know that we have a lot to cover. I'm Beth Kenefick. Welcome to our second of our Save Our Snap sort of 201 deep dive. As a reminder, this is for folks who are really into sort of the more nitty-gritty details of Snap. But we're going to share some updates and some other items since we last spoke. So just as a reminder, I'm Beth Kenefick. I'm with the Greater Chicago Food Depository, but speaking on behalf of the Illinois Commission to End Hunger. I'm joined with my colleague Nolan Downey, as well as Melissa Kundari, representing the Illinois Department of Human Services. As a reminder, the Illinois Commission to End Hunger is a public-private partnership composed of stakeholders across the state dedicated to the belief that no one in Illinois should ever face hunger. There's information on this slide for the website. There's a roadmap that we've put out as a commission. And so really honing in on these SNAP changes is core to the mission of the commission. And so we're excited to be hosting this event and continuing these conversations. Uh, just some sort of welcome and housekeeping. You'll see the agenda is not completely different from last time, but we do have some new information. We will give a couple of important updates around the changes. I know this continues to be an ever-changing item. We'll also go into SNAP work requirements, do a quick refresh of exemptions and what to do and the timeline for asking for those. And then start to go into the conversation around demonstrating compliance, because we know that that's been of interest, but we'll just flag that it's a continuing conversation, and then wrap up with opportunities to take action, some resources, and then have time for our Q&A. But just like last time, we will say all this information shared in today's webinar is as accurate as of today, January 13th. The state is continuing to get comments and guidance from the state and from the federal government, as well as continuing to update their own policy manual. And so information is still forthcoming, training is still happening with case managers. So just want to note that. As a reminder, this slide may be quite familiar for folks, but this is sort of our high-level summary of what happened in July under the HR 1 or the One Big Beautiful Bill Act. On the left, you see sort of the six buckets of sort of main changes, and on the right, sort of the high-level impact. And so always try to ground in what are those changes and what are we seeing with folks in Illinois. So as a reminder, 1.9 million people in Illinois are on SNAP, and we're really looking at sort of changes around work requirements and immigrant eligibility. Like before, all of our deep dives have really focused on the three that are outlined in red. It doesn't mean that the other three aren't important, but we're just not going into as deep of those conversations, and the sort of big impacts to our state are those first three. In terms of important updates, last time we spoke, we sort of provided we were barreling towards December 1st as a big sort of date. There was a number of things that changed leading up to that. And so last time we spoke, we clarified that the work requirements would now begin on February 1st. That's still the case. The change from last time is around the non-citizen eligibility changes. Those were sort of in pause as there were an ongoing lawsuit and sort of changes in guidance from USDA. As of now, those changes will happen April 1st, and those changes will happen upon certification. So in previous conversations, there was sort of a concern that everyone that was no longer eligible would happen all at once. That is not the case. So more to come as we get closer to April 1st and sort of how we can support the legally present immigrants that are here that are losing their status, but wanted to sort of first start with those important changes. And all this information is continuing to be updated on the IDH SNAP Federal Impact Center, which I can drop a link once I turn it over to my colleague Nolan, but that's where we're continuing to direct people for up-to-date information. And so we're going to do a little bit of a refresh around work requirements. What we covered last time was what they are, who's impacted, and then really went into depth, probably too much depth for everyone, around who is exempt and how to screen and report exemptions. We're going to touch on that a little bit again today because we know that you have to hear this information multiple times. We know it was a lot of information to digest, but we will provide some new information around how people meet and comply with them and how they regain eligibility. So with that, I'm going to mute myself and let Nolan take over.
Thanks so much, Beth. Hi, everyone. Nolan Downey. I'm the Senior Director of Policy at the Greater Chicago Food Depository. And as Beth mentioned, before we dive into what I would consider to be our main topic today that we haven't touched on yet, which is how do people demonstrate compliance with the work requirement, meeting the work requirement, do want to stress again that this is a very critical time to make sure that people are seeking and getting connected to those exemptions. The research surrounding time-limited adults on SNAP tells us that many of them, particularly those single adults who have been subject to the work requirements historically since welfare reform, that those folks have a lot of barriers to employment. And some of those barriers could give rise to an exemption. So while compliance will be necessary for people who do not meet exemptions, we know that many people should be exempt. So we'll just do a brief overview, as Beth mentioned, of some of the content today about exemptions as that reminder. But we covered it extensively in our last webinar, which you can find online. So this slide is really just reminding us again that with work requirements, we have two sets of work rules in SNAP, but only one of which was expanded by HR 1. So there are the general work requirements, which IDHS refers to as the work provisions, and then there are the work requirements and time limit for able-bodied adults without dependents, those more specific work requirements, which IDHS refers to as the SNAP work requirement. So if we go to the next slide, just want to explain that, again, the work provisions were not changed by HR 1, but these are the rules that require people between ages 16 to 59 to do things like register for work, accept a suitable job if it's offered to them, and refrain from doing things like voluntarily quitting a job or reducing their hours without a good reason. The SNAP work requirement that you see on the right-hand side of the screen, this was expanded by HR 1, and this is the one where some SNAP recipients have to work, volunteer, or participate in an employment or training program. And today we'll get into a lot more about what some of those things actually look like, where they have to do those activities at least 80 hours a month, or they only get 3 months of SNAP in a 3-year period unless they become exempt or otherwise regain eligibility. So those are what we refer to, those 3 months, as sort of the 3 countable months as 3 strikes. And this is the more specific work requirement that was changed by HR 1. If you go to the next slide, the households that are subject to both of these rules will get this SNAP work rules notice, which is IDHS Form 5175. That explains both sets of the rules and who in the household is subject to each of them. If we go to the next slide, the biggest change that was made in HR 1 with respect to work requirements was who has to meet them. And so again, that's that 80-hour a month requirement. The previous policy was that people known as able-bodied adults without dependents, or ABODs, you'll sometimes see as a shorthand, was these were folks that at the time were people between 18 to 54 and who didn't have any kids. These were folks that didn't struggle with any disabilities or physical or mental limitations that impacted their ability to work. There was no children in the SNAP household, and those folks have historically had to meet an 80-hour-a-month requirement, or they only get the 3 months of SNAP in the 3-year period, again, unless they're exempt or regain eligibility. The other key piece of this was that states with sufficiently high unemployment could also waive this policy. And Illinois has a long history of doing that. We've basically had a statewide waiver in place since 2009. And so while this policy was in effect, we actually haven't had to implement it very much in Illinois. But the HR 1 policy dramatically expands this work requirement so that now, starting February 1st, families with children ages 14 and older have to start meeting it. Previously, they didn't have to worry about it. And now non-disabled older adults between ages 55 and 65 also have to worry about these requirements. The other thing that HR 1 did was get rid of previous exemptions from the work requirement, like for veterans or for youth aging out of foster care until age 25. Those were two very specific exemptions that used to exist, but now don't any longer. It also obliterated really the state's possibility of waiving these requirements again based on the unemployment rate. We used to be able to do that if our unemployment rate was a certain percentage higher than the national average over a certain amount of time. Now we can only do that in areas of the state that have unemployment rates over 10%. Which currently would be none of them. So that's a good thing. High unemployment is obviously very damaging for a lot of other reasons, but that's a really high standard to be able to waive these requirements again. And so at least in the near term, we're not going to be able to waive these requirements in any area of the state. If we go to the next slide, the thing that we have religiously stressed throughout these webinars, again, is that many people should be exempt. And some of the exemptions IDHS can process behind the scenes automatically based on information that they already have. So the recipient doesn't have to take any action in that instance. Last webinar, we covered some of those examples, like for people who are receiving SSI, for instance, or maybe have someone in the household, their official SNAP household, that is under 14 years old. Like those are two clear examples where the department already has the information and they've been exempting people automatically. Where IDHS does not have the information to exempt people automatically, recipient statements are sufficient to verify exemptions. This is what's known as self-attestation. This is something that the department is really training their frontline staff to be able to accept customer statements for proof of exemption status. So people turning in the exemption form, IDHS form 2341, that we circulated after the last webinar, and I believe also after the second, but that many households have also gotten directly from the agency. That's a form that people could submit that should be proof enough of their exemption status unless that information is questionable. People also can report their exemption during a SNAP interview, or go ahead and do it on Manage My Case. And there are some, we'll get into a little bit about how mechanically people can do that a little bit later on. But in places where IDHS does think that information is questionable, there is another form that people can use to submit more information. That's the form 2340. And those might be like in situations where people have certain medical conditions where they're maybe in a position to get that form filled out on the front end, or they're engaging with homeless or DV services. The 2340 could be valuable in those situations, but it again is not required. That 2341 should be sufficient for a lot of people. If we go to the next slide, this is the full list of exemptions, and we went through each of them in a little bit of detail on the last call. So if you have questions, definitely feel free to follow up with us or watch the recording of the last webinar and see what questions remain. We recognize that a lot is changing quickly, and that this is all complicated, but this is kind of the full list that we just again wanted to kind of remind people of so that they have it at their fingertips and can begin to start screening the people that they come into contact with who are on SNAP to see if they maybe fall into one of these exemption categories and could submit the 2341 to get plugged into that exemption. So now we've talked a lot about exemptions. If we go to the next slide, wanted to talk about some of the different things people can do to start to meet the work requirements. So the way we think about this, if we're confronting this new landscape where we have this very significant and expanded work requirement, first and foremost, we always want to be thinking about, can people be exempt? But there are going to be a lot of people who don't meet an exemption. And so how do we support them in complying and meeting the work requirement? And there are a couple of activities that people can do that you see on the screen. They could work paid or unpaid, and I'll talk a little bit about what that means. They can participate in a work program, or they could volunteer, do community service that they themselves find and initiate. Or they could do any combination of those things as long as they're getting to that 80-hour a month requirement. So I want to have a couple of notes on each of these. So we'll spend a little bit of time on this slide, but I think there's a couple of things to just sort of voice over with respect to a couple of these things. So with work, when we talk about work, you see in the parentheses there, this can be paid, unpaid, in kind. Work is also technically kind of where the community service piece falls in, but I'll talk a little bit that as like a separate thing. But when we think about work, this can be traditional wage labor, right? Like I work for an hourly or salaried wage. This could be self-employment, or I work as an independent contractor. So that covers things like gig work. This could also be work in exchange for goods or services. And that work could be paid, or unpaid, right? Like exchanging, labor for goods or a service. For people who are non-exempt but subject to the work requirement, a good question to sometimes ask people is like, well, how do you spend your day? Not coming from a place of judgment, but because a lot of the things that people do could actually count as work. I think a lot about childcare, for instance. Last webinar, we talked about people who are caring for a child under age 6 who might be outside of their household. Because of the age of that child, that could be an exemption from the work requirement. But then what if that child is 7 or older, right? Maybe during the summers when the school is out, you could have a grandparent that is providing childcare. To me, that's unpaid work. So that's a situation where you could have somebody that was previously exempt because that child was not school age, but now is providing childcare for a school age child. You kind of could move them from like used to be exempt, but now this childcare that you're providing could be characterized as unpaid work. You could also do work in exchange for goods or services, or have it be completely unpaid. I helped my friend paint his house so that he would help me move, right? A little exchange for services. Who among us hasn't done something like that before, right? My wife's grandmother in Queens used to have people in the neighborhood come and mow the lawn in exchange for homemade crumb cake. Like, it sounds quaint, but that's the type of thing where it's like, look, people are doing activities that could count as work. This is work in exchange for goods and services. So people spend their days in all types of ways, and that, if documented, and that's really the trick with some of these things, that could count as work for purposes of the work requirement. And many times, that's really where the full 80-hour requirement is going to come in for people who are kind of engaged in some of the more non-traditional work, because recall from last webinar that people can also be exempt from the work requirement based on their earnings. And so if earnings are greater than or equal to 30 hours a week of the federal minimum wage, and that's like just over $900 a month, we explained in the last webinar that that's actually an exemption. So if people are engaged in traditional wage labor who are entitled to the Illinois minimum wage of $15 an hour, or in Chicago, the wage that's even a little bit higher than that, they're going to hit the number for exemption based on their earnings before they ever hit the 80-hour requirement. I think it'd be something closer to like 60 hours. So really thinking about the full 80-hour requirement, when we're thinking about work, it's a lot of times for people who could be self-employed, who are not entitled to the minimum wage, gig workers, independent contractors, because a lot of times folks who are working the 80 hours in traditional settings are going to end up being exempt on their earnings before they actually are worried about the time requirement. It's a little bit confusing, but I think that's some of the nuance with this policy when we're talking about like what people often conceive of as traditional work. The other thing that people can do is participate in a work program, and that could be through SNAP employment and training. But it could also be through a different program, like a WIOA program, for example. Generally engagement with these programs has to be for 80 hours a month, but one nuance is that for these programs that are considered workfare, and you can see kind of in the note at the bottom there, that in workfare, people are essentially working off their SNAP benefits. So the requirement isn't based on the hours a month, but it can be based on a person's SNAP benefit amount against the minimum wage. So again, if the state minimum wage is $15 and Chicago's is even higher, if someone outside the city, let's say, were to receive $150 in SNAP, that 80-hour requirement just became a 10-hour requirement if it's done through workfare. Because again, 10 hours at $15 minimum wage, you will have essentially worked off your SNAP benefit of $150 a month in 10 hours. So if we sort of set aside kind of the philosophical and moral considerations with an arrangement like that, this is a world where getting people continued nutritional support could be made a lot easier. The hour requirement could really be shrunk if it's done through these approved workfare programs. And I will flag that one of the things that the state is currently trying to figure out is what are the rules for the programs that can qualify as workfare and as other qualified work programs, because I think they're really thinking about growing that landscape to help support people who need to start complying with this requirement. A couple other things I'll just flag. I know we've been on this slide for a minute, but a couple other things I'll just flag is that people can also do community service. And so this does not have to be through a pre-approved volunteer opportunity. We get that question a lot. IDHS refers to this as self-initiated community service. So people could volunteer at their church, they could volunteer at a pantry, another community-based charitable organization. They'll just need to demonstrate on the front end that they're meeting the hours requirement. So a letter from the organization that's providing a volunteer opportunity would be sufficient. This person was here on this day for this many hours, and keeping that for your records is going to be important, but it's another way that people can kind of meet the work requirement. But volunteering is often where this last point comes in, which is that people can do any combination of the activities as long as they're getting to that 80-hour requirement. 80 hours a month volunteer opportunities are sort of hard to come by. I think it's also hard, again, when we think about just what kind of activities do we want people to be doing, it's a little bit, we find at the food depository sometimes a little bit tricky to justify somebody working unpaid labor 80 hours a month through volunteer just to get their SNAP benefits. But volunteering can be really useful where it's used to supplement other activities. Like maybe I'm working 65 hours and I can volunteer 15 more just to get to the 80. I think that's where volunteering and those opportunities can be really, really helpful. So if we finally go to the next slide, this is a lot of text to make a very simple point, which is just that 80 hours a month means 80 hours a month. It's a calendar month. It's not a weekly requirement. So just to use an extreme example, somebody could not engage in any kind of work activity that we just discussed for the first 3 weeks of a month, and then maybe they work 80 hours in the fourth week of the month, right? Like that's an extreme example. That's a situation I would be concerned about for other reasons, but that would technically meet the work requirement. As long as you're getting to the 80 hours in that calendar month, like that is what really matters. It's important because you sometimes see this work requirement expressed as, an average of 20 hours per week, or sometimes even more imprecise, like 20 hours a week. But there is no weekly consideration for how much activity people have to do. It really is just based on the month. 80 hours in a calendar month, however it is that you get there. If we go to the next slide, just want to highlight that what happens if you don't get to that 80 hours a month, right? And that's where this really important concept comes in that's called good cause. So this is another layer that's really important for folks who are out in the field to understand, because first and foremost, a person could be exempt from the work requirement, right? We spent a lot of time on that. The second piece is that they could be non-exempt, but they could also be meeting the work requirement. They could be getting 80 hours a month through one of the activities that we just described. The next layer is that a person could be non-exempt and not meeting the work requirement, but having a good reason for not meeting the work requirement in a given month. So what counts as a good reason? Well, this is one of the places where the agency does have pretty immense flexibility, because the regulations say good cause could be any situations beyond the individual's control, right? So situations beyond the individual's control, that is really like, that's pretty broad in scope. And so there are some examples that are even specifically called out in federal regulations that, you know, people would have met the 80-hour requirement, but they missed 2 shifts because they got sick. Or, my teenage kid in the household got sick and I had to take care of my kid. My job cut my hours. My car broke down. I had to call off because my basement flooded. You know what I mean? Like there's a lot of different things that could be good cause, really allowing a person to say, hey, I was on track. I was going to meet this 80-hour a month requirement. And the reason I didn't meet it was because this other circumstance happened. Life happens. Again, there are infinite situations that could cause a person to miss work and thus not meet the work requirement. So we'll talk about this again toward the end, but it's important that if people are not exempt, and they're going to have to report that they fell below the 80-hour a month requirement, they should always, always, always tell the department why they fell below the 80 hours, because that why could give them good cause. So if we go to the next slide, just with exemptions, merely telling the department about the circumstances that created the good cause should be enough. This is another place where they are accepting self-attestation. So no documentation is required unless, the department considers it to be questionable or there's other information that they have that is contradictory. So again, just referring to those examples, my car broke down, my kid got sick. Caseworkers should not be saying to people, prove it. Those are statements that should be accepted unless there's some reason for them to question it. So there is some discretion here, but I know this is one place where department leadership has really been trying to train frontline staff to be reasonable and not hound people for unnecessary documentation. So this is another place where a customer statement about the situation that gave rise to good cause should be sufficient. Now, if we go to the next piece, another layer here that we get a lot of questions about is reporting. What do people have to tell the department from month to month? Well, first, what does the department have to tell you? So the department should be telling people at initial application and redetermination about their obligations under the work requirement, both in writing and orally during the SNAP interview. So there are people who have already received courtesy notices about these changing rules. More notices, we're told, will be coming to people who are impacted by these in the coming weeks. But before February 1st, people should, I think, first and foremost, see if they meet an exemption always. But then if they don't, make sure that their current work situation is accurately reflected to avoid losing any countable months unnecessarily. So if you're working, volunteering, doing a training program for how many hours, just make sure that the department knows that. And it's really important for that information to be up to date in the system before February 1st. But if we go to the next slide, the biggest question is, do you have to tell the department every month that you got to your 80 hours, right? Like these start in February. Okay, I worked 80 hours. I tell the department. If my situation stays the same in March, do I have to tell them again that I met the requirement in March? And with the department's recent adoption of simplified reporting, even those who are subject to the work requirement are going to be in simplified reporting. People's reporting obligations are generally reduced. And so this is one place where we get a lot of questions and there's a lot of complexity. I'm going to do my best to just sort of highlight some high-level common situations about how this plays out, but this is one thing that we very much, are still continuing to figure out with the department. I would look to Melissa to keep me honest about this piece in particular, because the reporting is definitely one piece that people have a lot of questions about. So under simplified reporting, people should always report just for their, own sake, not because it's under program rules they have to do this, but they might be losing countable months unnecessarily if they don't report when they become exempt. So if you have an exemption, whether or not the department knows about it, like always report and make sure they are aware of any circumstances that give rise to an exemption. So that's definitely something that people should always report. But the other thing under simplified reporting is people always have to report if their household income goes above the income limit for their household size. So that is a situation where under program rules, people have always got to report that, because of that, then you're no longer eligible. So you've got to report if your income raises substantially to take you over the income limit. But generally, And particularly with traditional work, people are not obligated to report now every little change in their circumstance or income. What matters for purposes of the work requirement, as we understand it, is whether you're getting to 80 hours or not. So it's more of like a binary. Are you meeting the work requirement or are you not meeting it? And in the reporting, you really generally only have to report when you fall between those two situations. So that's why it's important for the department to really understand where people are February 1, because if you're in the system as meeting the work requirement, working 80 hours a month, you're not going to be required to check in every month and say, hey, I met again. I had 80, I had 80, I had 80. You only have to report if you then go below 80. So that's really the nuance there, where whatever situation they have reflected in the system, they're going to assume it's the same unless you change between complying and non-complying status. And that's when you definitely have to report and make them aware of that. So just to kind of like think through this, and I know this is a little bit counterintuitive, but if I applied in March, let's say, and I was self-employed working 80 hours a month, that's great. I'm meeting the requirement that's reflected in the system. We're good for March. But then let's say in April, I go from 80 hours to 90 hours, my hours goes up. I maybe even have a little bit of an additional income from that. But even there, I went from complying to still complying. I didn't change between that binary. So I don't have to report, again, assuming that that little bit of increased income didn't take me over the income limit. But that's a situation where before people would have had to report that change. Now they don't. They stayed from complying to still complying. Then let's imagine the following month in May, I work 85 hours. Same thing. Don't need to report that. Still complying. But then let's say in June, my hours fall to 40, right? Now I need to report it. And I went from complying to now not complying. But remember, this is critical, I might have good cause for why that happened. So yes, I would have to report that change. But when I do, I should tell the department, why did my hours go from 85 to 40? Because that could mean I have good cause, and then I won't get a countable month for that month. So again, a lot of sort of complexity here, but that's another place where it's just really important to try to understand some of the nuances, because otherwise I think people are going to be generating a lot of things that they don't actually have to report. If you're meeting and you continue to meet, you should be good. I would just highlight a couple of other things, like for things that aren't sort of traditional wage labor. The department has some tools at its disposal to be able to kind of track. They utilize this tool called the work number. They have some data checks that they get from IDHS. Like they can see people's wages. But for things like, volunteer services or other training, programs, it's going to be really important for people to maintain records of doing those things. It's still the same situation where if you're meeting, you don't have to continue to report every month that you're still meeting, only when you switch between the two things. But keeping some of that proof for something like volunteer service is going to be important, because the department's not going to have any information at their disposal to say one way or the other whether you were volunteering. That's going to be important for the participant or even the service provider to really try to keep those records to keep people protected. So I think with that, there may be a lot of questions about this in the Q&A. I would just say, and again, remind people that, if you don't report, you could be ticking countable months. That is something that could generate an overpayment. We also talk a little bit about, regaining eligibility at some point. But I mean, this is one place where, you only get, again, those 3 countable months in that 3-year period. But I did want to flag for folks here that our 3-year period actually resets at the beginning of January 2027. So this is one where, generally speaking, it's three months in a 3-year period. But just because of the way the timing was on our implementation in Illinois, folks are going to get another 3 non-consecutive countable months at the beginning of next year. And so we'll do another push through the commission and through other channels to make sure anybody that loses SNAP benefits in the meantime understands that they could get back on in January 27, but that's a little bit of a ways out. I think the important thing to understand on this slide is that there's also this concept about regaining eligibility for people that may have lost their 3 strikes. So if you're not meeting the work requirement, you take your 3 strikes, you get terminated. If you then regain eligibility at some point in the future, you start working 80 hours a month. Really, I think we'll use that situation to kind of describe this. You start working 80 hours a month again. Even if you immediately fall off from working 80 hours the next month, the first time you regain eligibility, you get this little grace period, this like 3 consecutive months where you can continue to receive SNAP no matter how your circumstances change with respect to work, sort of like a second 3 strikes. But that, we can answer questions about that. It's a little bit complex, but that's one place where people may just want to be aware that if you can get to 80 hours at some point in a 30-day period, you could get another 3 strikes, which can help people, again, push us toward that January 1st where, the clock resets and we can maybe keep people supported for more months out of the next 12 than maybe we otherwise would be able to. So we'll go to the next slide, and this may be where I'm passing it back to Beth.
Yes, and I will unmute myself. We realize that a lot happened in those things, and it's still a little bit squishy. We're still figuring it out. But the focus right now is still around understanding between now and February, are people exempt? So just flagging again that on ABE, there is a check if I meet the SNAP work requirements, which leads to a screener. I know that they're continuing to make adjustments to the language and information on the screener, but we would, and it is available in Spanish. You can also change the browser on Google Chrome, and it will come up in other languages. Obviously, that's dependent on the browser's ability to do that. But would sort of direct people to this as like as a first sort of pass at like what to do if you're confused, if you think you fall in this ABOD population. You'll see that when you click yes on any of the questions, there's then sort of an answer that talks about what to do and a link to a number of different forms that we went over in depth on the last webinar. And then if you get to the end and you still click no, that's where they'll talk about that you need to comply. And so we'll say this is what our first attempt at sort of talking about that was this webinar. And we're going to go through all the forums, but the ones that are of relevance to look at are one, you can do all of this through Manage My Case if someone has access and already has a sort of login to that portal. You can also use the change report form. That's where you would sort of say, like, I'm working different number of hours, or I actually have a kid on my household you don't know about. A lot of those sort of like case specific questions. The 2341, the last form, is the one where you go through and sort of note if you have an exemption. And then the 2340 is if you feel like you want to have sort of extra information from a social service provider or a medical provider. But as a reminder, the 2340 is not needed. Just filling out the 2341, as long as it's not questionable, will allow people to move forward with this. The best way to know that you submitted all these things is to upload them through Manage My Case. We recognize that there are sometimes technology issues with that, so there are other options that we'll walk through. And in Manage My Case, for folks who are currently deemed ABODs, there's sort of a Manage My SNAP Work Requirements button, and you can go in there to sort of click and submit stuff. Oops, sorry. It's going back. And you can submit your exemption that way. In terms of submitting, as I mentioned, you can submit an exemption at any time. You can do it going to your local office. You can do it through a phone. You can upload things to ABE through Manage My Case. You can fax the central scanning unit. You can bring in person. And anyone that has questions can talk to the IDHS helpline. You can look for an office near you, or if you have issues with Manage My Case, you can contact Abe, if you are someone that helps people enroll, that's a good, helpful email to have. And social service providers, such as many of you on this call, can help people with completing this process. In terms of confirming, as I noted right now, the only way to confirm is by contacting your local office, calling the helpline, or asking or going into manage my case if you use that. So there isn't sort of a notice that is at this point populated to say like, check, we've got your exemption. And so if people want to double check that and make sure that they're okay before February 1st, they can do one of these options. In terms of timeline, we are now in January, not December, but the best time to sort of screen and apply for exemptions is now through the end of February. So you technically within the month of February can contact IDHS and let them know that you're either complying because you're working or submit one of the exemptions, and you can prevent February from becoming a countable month. And so this is why we're sort of having these webinars now. This is why we're putting out all this information, because now is really that push to try to get all the potential ABODs who are not exempt and not complying to sort of go through this information and make sure that everything is up to date. However, as a reminder, it doesn't mean that if you wake up on March 1st and realize you didn't do any of these things, or your situation changes, it doesn't mean you sort of miss the boat. We always encourage, going back to the reporting conversation, to sort of apply for exemptions. If your situation changes, it's also a conversation that will happen at folks' next redetermination recertification. And so knowing this information as you sort of prepare for those conversations or filling out those forms is really helpful to make sure that as you get recertified, you can make sure that the department knows any potential exemptions or that you're meeting these work requirements. In terms of opportunities to take action, this is a lovely list from the Department of Human Services, which is why we're having these webinars. Community partners can help minimize customers losing benefits. So we're looking at around 1.9 million individuals are on SNAP in the state of Illinois. In July, when sort of who considered an ABOD changed, we looked at around 446,000 folks are considered ABOD. So almost 25% of our entire state caseload. We know that they're working really hard to sort of use back-end information, and people are submitting forms. And so we know that sort of non-compliant, non-exempt number is getting smaller, but there's still time with which to do more and make sure that people are complying or to show that they're screening. So that's with help with you all. Something that the Commission to End Hunger has produced in the last couple of weeks that's new since the last webinar is some toolkits. So we'll put the information in the chat, but on the Illinois Commission to End Hunger website, you can find fact sheets, posters, flyers, social media posts, captions, graphics, sample copy, etc. And so we're really trying to flood the zone across the state to make sure that people know about these changes and that they can use their own agency to try to make sure that they're exempt or compliant to the best of their ability. And then these are not new, but if folks need help, you can go online, you can visit the local office, you can call the helpline. You can also identify your area's local SNAP outreach plan partner. There's a number of them across the state. We're working on a way in which to sort of have those listed. And when we do, we will share that out. More information, as we mentioned, there's the SNAP Federal Impact Center. We Got You Illinois, which is a website that's created by the Illinois Commission to End Hunger, the Illinois Commission to End Hunger's own website. If you are sort of in the weeds, IDHS does host a benefit access group monthly meeting. It just met last Friday, and you can get added to that where they share information. And then the food depository leads sort of an advocates monthly meeting as well. This is just information. We're continuing our webinar series. So the next one will be in February. And then depending on demand and interest and information may continue into March and April, but more to come. And with that, we will move to Q&A. There were a lot of questions. I will admit that not all of them have streamlined answers yet. We've been trying to answer as many as possible. I do know that there was one that was asked that we may have accidentally clicked something, so just wanted to voice that over. If someone is generally working 80 hours and then takes off 10 hours for a vacation, that's fine. They are still meeting the work requirement. You do not have to report anything. And I'm going to scroll up, but I'll see, Nolan, are there any that you want to pull out immediately? I'll also say this is being recorded, slides will be shared, all that kind of stuff. I know that that's always a hot topic question.
There was one that I wanted to pull out that had to deal with sort of the exemption request process that's done through Manage My Case. There's a great question here that's asking if there are plans to update the Manage My Case exemption request feature to allow for more boxes to be checked. Because one of the things that I wanted to voice over is that when people go in through Manage My Case and do that, the list of exemptions that comes up for people to do it through Manage My Case is much shorter than the full list that we presented. And so, if one of the ones in Manage My Case applies, people should definitely click that one and go for it. That list, I do wonder if there are plans. I can't speak to the department's plans about whether updating it, but it is something that we flagged for them because um, that list I think is just as it applies to the work requirements. But remember, the work provisions exemptions can also exempt people from the work requirements, but I'm not sure they're reflected in Manage My Case. So that list is shorter. But if you see something on the list that we presented, that list is straight from the 2341, and we think it's the more complete list of exemptions. And so if there's one that's on there that doesn't show up in Manage My Case, one strategy could just be to submit the completed 2341 and Manage My Case if the actual list there doesn't encompass the one that people are trying to request.
Mhm.
So hopefully that makes sense, but did want to acknowledge that right now the list of exemptions in Manage My Case is shorter than the one that appears on the 2341.
Mhm. Just a couple of the ones that have been answered that I want to voice over. Someone asked if there's an exhaustive list of good cause. No. I think the thinking there is that when you make an exhaustive list, then people think that's the exhaustive list. And then if the item is not on that list, then it doesn't count. And so I know a policy manual is coming out, trainings are happening, other kinds of stuff, and they're really trying to lean away from sort of making it seem like these are the only things that can count for good cause. And so to Nolan's point previously, if you go from 80, 85 hours under and you want to something less and you want to report that, say why, because you don't know. It could be your transportation, you ran out of gas, you were on vacation, other kinds of stuff. And so it's really helpful to sort of add that because that information is sort of variable and it goes back to that definition of sort of outside your control.
Yeah, and I'll just add to that, Beth, if you don't mind. I think the key for good cause is it's temporary. And so just reading aloud from FNS guidance, the absence from work, the work program, or workfare must be temporary. And also, so for example, if someone lost their job, then they could get good cause for that month, but potentially not going forward. So just wanted to add that.
Thank you. Yeah, and it's good cause for if you were already
Yeah,
needing it. And so not like I can't find a job necessarily.
right.
There's a couple of open ones still. During the last webinar, we talked about caring for a disabled adult would only exempt one household member from the work requirement. However, if there are two caretakers in the household, if one caretaker is exempt because they care for someone with a disability, can the other caretaker meet the requirement by doing unpaid caregiving work? And this may be a situation in which we don't quite have an answer and we add to our scenario list, but
Is that generally right though, Melissa, that if it's based on caretaking for, let's say, the incapacitated adult situation, if there are two other able-bodied folks in the household, it would only exempt one of them on that basis?
That's right. Yeah.
Okay.
Yep.
is there, that's an interesting question
It
about
is
whether there's a
interesting.
path to exempt or say the other one is complying based on unpaid care work.
Yeah, I don't know if that would be sort of double dipping, if you will,
Yeah.
but yeah.
We will add it to our list of scenarios. We were going through before this webinar a number of ones, and we know that this is going to continue to be an ongoing situation. I will say, when we send out the slides, if there are common situations that you know of or questions like that, please reply back to that email with those, because we are trying to come up with some of those like frequent scenarios and try to see if there are sort of clear answers that we can either share out in the next webinar or on other materials. Autumn, are you raising your hand to be able to add something?
Yeah, and it's a clarifying question, if that's okay. Regarding not being able to find work as a good cause, if the individual could present uh, documentation or proof that they are in fact actively looking for employment, had not refused any employment, but did not receive any offers, would that count as good cause?
Um, no, not technically in accordance with policy. We do have in our work provision policy things about unsuitable employment. So there's some things there that, are a little squishy, that could potentially apply to someone in that similar vein. So I'm going to go ahead and put that in the chat. Unsuitable employment is a good cause reason. And we try our best to define it. Whoops, I just put it in the host panelist chat. But it is a way that some of these scenarios that you just described, Autumn, could potentially apply, but like that clear definition in and of itself would probably be no.
Thank you. That's helpful.
Mm.
Someone asked, if you're saying you're earning the $217.50 per week, will IDHS be able to confirm that through records, or are there cases where you'll need to prove it, like if you're paid in cash?
I mean, I definitely think in the paid in cash situation that I think I'm looking at Melissa here, but I definitely think that's one where you should make sure they're aware of how much you get paid. Like that's one where they're not going to have, I don't think the work number or some of the back end data that they
Exactly.
get
We
from the
wouldn't have
Department of
that.
Employment Security, they don't have that.
Hmm.
But that doesn't mean that you have to then report it every single month, month after month. As long as your
Hmm.
income stays the same or roughly the same from month to month, or you don't move between those two complying versus non-complying kind of binary, you don't have to keep checking in, but you do have to make sure they're aware of the income on the front end because they're not going to have any back end data about somebody getting paid in cash.
Yeah. And if someone's getting paid in cash, like it would have to be verified some way, somehow, whether that's in the form of a letter or something from the employer, but there has to be some income verification.
Um, and then building on that, I know we sort of touched upon it, but I know it's probably confusing. Talking again about the 80 hours or meeting the dollar amount.
Yeah, yeah. I actually think this is one of the blessings of the state having a higher minimum wage is like in practice, if somebody's engaged in like traditional hourly wages, like they're gonna hit the exemption threshold before they get to the 80 hours. And so my understanding is that the system that IDHS uses will actually reflect that as an exemption first. And keep me honest on that, Melissa, but I think
Yep,
it's an exemption first before we even worry about are you getting the hour requirement or not.
exactly.
So
That's how that works.
that's a key one because there are a lot of people who will not get to 80 hours potentially, but because they're maybe working 65 hours at Chicago's minimum wage, let's say, they're exempt because they're getting to the good amount of earnings, the high enough amount of earnings to be, meeting that threshold. We could see
Yep.
this in some situations with self-employment too, where like, maybe, you're engaged in self-employment through, a business that somebody owns, and maybe they're able to make $1,000 a month, let's say, only engaging in 10 actual hours of work. I'm open to the suggestion that that's a possibility. Maybe someone, does some sort of special service for somebody or something, but that's one where like clearly they're not getting to the 80 hours, but their earnings are high enough to make them exempt. So I think the useful way maybe it's most helpful to think about it is like, if somebody has earnings, let's first think about the earnings. Are they over that earnings threshold? And then if they're not, let's think about, are they getting to 80 hours, if not through traditional work, like some other way? Are they doing community service? Are they in a training program? Those other things. But my sense is that in practice, a lot of people who are actually working in that traditional work are, going to get the exemption based on earnings before they're meeting the 80.
Good point. Yep.
Someone asked about the 3-month, 3-year rule. And so just to clarify again, the first question is, do you fall into the ABOD category? If yes, then you're susceptible to the 3-month, 3-year rule. But then the next question is there an exemption? So if you have one of those lists of exemptions, then and the department knows about it, then you're okay. No sort of countable months will happen. You'll only have come February 1st, if you have none of the exemptions or IDHS doesn't know about it and you're not complying and they don't know, and they know that you're not complying, then you'll start to have the three countable months within the 3 years. So hopefully that clarifies that for the person that asked that. Just looking through.
There's a question here about, and this is, this is confusing, admittedly, but the 3 strikes you get at first, and then the sort of second set, so to speak, if you regain eligibility, the first 3 are non-consecutive. So like you can meet the work requirement February, March, not meet it in April, and that's strike 1. But then if you go back to meeting in May, it doesn't reset. You're still at 1 strike in those non-consecutive months. So it's really like, do you get the 3 strikes over how much time until the clock resets? But it's non-consecutive months. So that's the first set. Now, if you lose those 3, let's say you're not complying 3 months in a row, but then at some point later in the future, you get a new job and you start working 80 hours a month, that's when that second 3-month grace period sort of kicks in, where no matter what happens with your work, you can stay on SNAP in that sort of 3-month period. And that is a consecutive 3-month period. So it's super confusing the way that this federal policy is, but that's kind of the way that goes. First set of strikes in a 3-year period is non-consecutive. The second set is consecutive. And then even after that consecutive set, you can always come back to the program if you become exempt or you start meeting the work requirement again, as long as you're meeting.
I know we're getting close to time. Someone asked again about the different forms, and so I just wanted to pull up this slide. We would first sort of advise folks to go to the screener. You can just sort of log in to manage my case, and there's a button that you can click and submit. They are actually editing the text because I think there was some confusion around acquiring a form for one of the exemptions. And then there's the 2341, which you can do if you would like to submit a form and click the box. And then the 2340, the one that can be completed by a medical or social service provider, is not required. It's just sort of an extra way in which you want to demonstrate your exemption. And it only sort of if things are questionable, but they're working on trying to train caseworkers to really take self-attestation. And so we would advise this, if someone really wants to have sort of that extra proof, or if they're, happen to have a doctor's appointment right before their recertification. It doesn't hurt to fill it out, but it shouldn't be required. And if folks are starting to feel like different caseworkers at certain locations are asking for it, or if they're getting conflicting information, this is all brand new for the thousands of folks across the state of Illinois that are doing this. And so we know in the next month, February, March, April, it's really important to sort of lift up if people are hearing different things and sort of make sure that we're going to those offices and those locations and just confirming that processes and training and everything is as it was. And so we, on behalf of the department, sort of ask for grace as they are continuing to roll this out, train folks, and really just sort of lift up sort of those feedback loops. Nolan or Melissa, any last questions or comments that you want to answer before we sign off?
I'll just highlight two super quick, which is the way that the exemption on earnings is expressed, I think on the form is like 217.50 a week because it's like 30 hours the federal minimum wage. But I think because the department, I want to say, uses 4.3 weeks per month in the system, you could also express that monthly as like 935.25 a month. So like that's the 217 is if it were based on weekly, but remember the requirement is a monthly one. So I think you could express that monthly as like 935 a month to make sure that you're getting the earnings. But then that is different from workfare, and workfare is the one where you're sort of like working off your benefits. So it's not based on hours or earnings, it's based on your SNAP benefit amount. And so just to keep the math clean, because our state minimum wage outside of Chicago is $15 an hour, if you get $300 in SNAP benefits, let's say, that requirement, if done through workfare, is only 20 hours because you're essentially like working off your benefits. So that's the one where there's a little bit, the workfare rules are kind of unique in terms of what you have to do there. But I think the main takeaway here is that even if somebody isn't working 80 hours a month, like let's collectively as a movement take a hard look at their case, because there are a lot of exemption things that could be going on, but there are a lot of different ways also to get to not using up accountable month. So we'll continue to think about ways that we can support each other and ask each other questions given how complex this stuff is. But there are a lot of ways, I think, to navigate this for folks and to keep as many people attached to critical nutrition support as possible.
I will just flag someone asked about languages. I will get back to you on if there are additional languages. I know we've done materials and additional ones previously, and so I'm not quite sure the plan for that. But thank you everyone for joining. We will send stuff out probably later this week, and we'll continue to stay in conversation as things continue to change, and really appreciate everyone that joined and sharing this information.